I'm Jennifer Hamlin, and I'm going to talk today about care planning and how the nursing process is involved in care planning. So if we think about our last discussion that we had about nursing theory, there are a lot of big words around that. And I know that it can possibly be quite complicated to consider how nursing theory really impacts us every day in practice. But we can actually start to think about those ideas and goals that we have as nurses and how to utilize those in our own nursing process. So if we think about it, I'm sure you all have heard of care planning, and you've probably already learned about it quite a lot. But we have really refined our care planning studies and focus in nursing to help us to be more effective at care planning. Because in the past it's been something that has been really not very well done in veterinary nursing. We haven't really had a very strong nursing theory. So developing nursing care plans hasn't really happened and it hasn't really been as effective as we would like because we just don't have the theory behind it. So nursing care planning, I'm sure as you've heard, it's the focus of it is that we're documenting care. We're planning it, we're standardizing it, we're making sure our communication is really effective, that everybody in the clinic knows what we're doing, and that we're sure to not miss anything out. Because I'm sure a lot of you think, oh, I do a good enough job because my patient comes in, I know how to deal with it. Comes in, I know if this patient has kidney failure, I'm just going to do what the vet says. I'm going to take radiographs of bloods and put it on fluids and all this stuff. And I already know how to do all that stuff. But actually, if you thought about it really carefully and you thought of all the potential risks that that patient could go through as a result of having kidney disease and all the treatments that it's going to undergo and all the potential risks, you might find that there's quite a lot of things that could easily be missed out because you're such a pro at it, you've done it a million times, and it's very easy to actually miss out things. So this is part of the reason that we implement care planning. It's to make sure that we're all on the same page, that we never risk missing out something that's really critical. It's a very, very important part of our professionalism. And we really should be making an effort to make it easier and more achievable to do in practice. So let's just recap. In our last lesson, we talked about the ADPIE nursing process. This process is standard for all nursing. It's basically a sort of summary of what we all do every day without writing it down. And it helps to make sure that we really deliberately achieve each one of these things. So we're focusing on ADPIE when we address every patient. In that process, we're unintentionally creating our own care plans for the patient. We're doing care plans already, even without writing it down. So by including the concept of ADPIE in our nursing, we're just making sure to write down and document and standardize each stage of the process, and in turn, really give us something to work with when we're trying to do quality improvement and reflective nursing and evidence-based practice. So if we think about the patient assessment in the ADPIE process, we're thinking about looking at the patient and considering what's in front of us and how we're going to collect that data, what data is most important at that particular moment. And by looking at that data, then we'll decide what care the patient needs. And we're inadvertently doing all of this already. When the patient comes to the door, the vet says, this patient has just been hit by a car. We automatically make an assessment in our mind. The data that we're collecting is the diagnosis the vet has just given you verbally. It's looking at the patient, seeing that they're a cat or a dog and how you might treat them differently as a result. It's looking at whether it's old or young and how you might treat it differently as a result. If it's bleeding or in shock, conscious or unconscious, you're making that assessment of the patient right then and there. We do this automatically, but writing it down and starting to document it will enable us to provide better care. So we collect the data. There's different stages of data collection. As you just might imagine, when a patient comes to the door, it's been hit by a car, you're going to make some really quick decisions just based on what you're seeing and hearing, and that's your data that you're collecting. You're prioritizing care right then and there, and then you'll reassess them after a minute, or you collect the data slowly over a period of time once a patient is not bleeding out or not having an airway. So there's an admission assessment when the patient's admitted. You'll just quickly make that assessment. If you're starting in a new shift and you're swapping over from another nurse, you need to be able to assess the patient and say, do I know this patient? What's this patient's normals? And talk to the nurse about it so that you get a chance to really determine where you're going from there. Don't just trust somebody else's assessments. You have to look at the patient yourself. And then if the patient's condition warrants a focused assessment, then you'll be looking specifically at a certain area and prioritizing that over other things. Prioritizing is absolutely key to care planning. You cannot use an ordinary nursing model that includes 100 different things. It's not going to be workable. You're going to have a patient that's hit by a car, and you're not going to be able to use all those things on the care plan. You're just going to throw it to the side and just going to get on with business. Whereas if you have a care plan that you can really legitimately use in times of different priorities of needs, then you'll be able to actually begin to document care, even in the most urgent situations. What might happen is a patient comes to the door, it's hit by a car, and you'll say, right, I'm going to immediately check the vital signs of this patient. Your assistant nurse might be right by you, and they'll get out the priority care plan and start writing on that care plan about what your top nursing diagnoses are for that patient, and you'll have documented it. In 2 or 3 minutes, your care plan is already documented. It needs to be that achievable, otherwise you won't do it. So think about prioritizing ABCs. You want to make sure the patient is not bleeding out, that it has an airway, that it has a heart rate. Think about actual problems that you're seeing versus potential things, like that patient could go into respiratory arrest if it has asthma, or maybe it actually has a problem that its airway is compromised because it's been hit by a car. If it's an acute disease, that's potentially really different to you than a chronic disease that's been going on for a long time. And then also consider Maslow's hierarchy of needs. We talked about that with the ability care plan. It is important, but there are limitations to it. It's not perfect for animals. It's not actually perfect for humans. But once you've done all the emergency stuff, you do need to think about the other things that make this animal's life a quality. Can it groom? Can it move normally? Can it exhibit normal behavior? We need to be thinking about all the other things as well once we've sorted out the most emergent issues. So your nursing diagnosis, this is not a veterinary diagnosis. This is a diagnosis a nurse makes based on what that nurse is seeing in front of them, the data that they're seeing. And they look at the data and then they make a decision about what that patient needs, how the nursing care is going to be changed based on your nursing observations. This is difficult, I think, for some people to get their head around. What does this mean? Basically means I see this patient, it's just been hit by a car, that's come through the door, and I think this patient is at risk for bleeding out because it has a wound. That's your first nursing diagnosis. You are addressing that issue that could be in front of you. It's your nursing action, so you're going to be monitoring its cardiac output. That's your plan, is to monitor cardiac output. And the intervention is to actually look at the heart rate, look at the capillary refill time, look at the mucous membrane color, look at the lactate levels, and really assess how that animal is doing in terms of its blood volume. Those are your actions based on your observations, based on your nursing diagnosis. So you're basically identifying and writing down the key issues. You should be able to do that with any patient. What are the top 3 nursing diagnoses you have? This patient is at risk for this patient is at risk for that, this patient has that. Those are your first 3 things that you've identified that are called a nursing diagnosis. Once you've done that, and you have an idea of the top things that are occurring with that patient, then you make a plan, just like I described a minute ago, about making a plan about what you're going to do next to address this patient's condition. The planning is really important in terms of making sure that you are linking up the diagnosis with the interventions that need to occur in order to nurse the patient. So it's actually planning out your nursing care, you need to do that with SMART goals. So you're actually going to achieve stuff that is relevant and that is measurable and time bound. Those are really important part of nursing care planning. And then once you implement it, it needs to be documented in a way that everyone can achieve. So if you're going to say this patient here needs to be toileted every hour because it's got a urinary infection, it needs to go outside, and it needs to have the opportunity to toilet in the room, then document it. Put it on the nursing intervention sheet, say toilet every hour, and tick it off when it's done, and make a comment about what you've observed. And at that point, you're going to look at the interventions that have occurred and the comments that have occurred, whether or not it's been you doing it or someone else is doing it, and you're going to evaluate the patient. If that patient has toileted normally, if it's been in pain, you're going to make a decision at that point about whether or not your care plan needs to change. So here's the process simplified: assessing the patient, diagnosis and planning, implementing those nursing interventions, and then evaluating on the fly, anytime. Change the care plan if you need to. You don't need to keep a care plan. If it's not working, change it. You might need to just throw out one care plan and just start another. The care plan should be simple and easy to use. So for example, say you have a patient with a medical diagnosis of pneumonia. The ADPIE nursing process starts with patient assessment. So you look at the patient. The available information for the assessment might include the medical diagnosis. The vet might say it has pneumonia, has dyspnea, has mild dehydration. Your nursing observations are very different than that. So you might listen to the patient yourself and hear crackles. You know what that patient's normal sounds like in its lungs. You might see its respirations are shallow. You might see that it has a high respiration rate and a high heart rate. You might see that its cardiac output is not ideal. And you're going to develop a plan based on what you're seeing in front of it. It doesn't matter what the medical, well, it does matter what the medical diagnosis is, but you should still be collecting data yourself as a nurse. So we're going to think about priorities. Where does this patient sit on nursing priorities care plans? Is it a high priority, a medium priority? Where is it going to sit? How are we going to create a care plan right then and there? We don't want to be faffing around and going through care plans that aren't suitable for this patient. So you can get one of these templates and create and start the care plan based on the priority that it has. So priority 1, life-threatening. It's got an airway and respiration issue. That's priority 1. You go into respiratory arrest at any time. That needs a priority 1 care plan. And this is what that might look like. So you just get out that care plan template and you just begin. So the first nursing diagnosis has compromised breathing. So ineffective airway clearance might be your top nursing diagnosis. Impaired gas exchange, so it's not breathing normally, so it's not going to be oxygenating well enough. Ineffective breathing pattern, it's got really shallow respirations. So you need to encourage that patient to get oxygen, to breathe normally. You put it in an environment where it's comfortable. Those are all things that you know in the back of your mind. That's how you're going to establish your plan. So when we think of the nursing diagnosis, we're thinking about the diagnosis developed based on observations and problems that we identify in combination with the medical diagnosis. All these things help us to plan what we're going to do to address that patient's problems. So we think about those 3: nursing diagnosis, and we create a list of things that we're going to do to actually do something about it. So we're going to make an intervention sheet. We're going to think about the risk of respiratory arrest, listen to their lung sounds regularly. We're going to monitor gas exchange. We're going to look at maintaining clear lung sounds. All those things are part of the planning and implementation. And this is what that planning and implementation looks like. And you'll evaluate and change it as you need to go. That's really an important part of the plan. Change the care plan if you need to. So that's what we need to be thinking about when we're thinking about care planning. If you have any questions, just